Hey there, knowledge seekers. Feeling a little stressed this morning? Well, let's turn that nervous energy into quizzing power with the Explainer's Hypertension Challenge. Whether you're a health buff or your blood pressure is a bit of a mystery, this quiz will test your knowledge and leave you feeling informed. So, grab a healthy snack, hold the salty chips, hit that subscribe button, and let's get ready to explore the world of high blood pressure. Remember to share your scores in the comments. Question 1. What is the normal range for blood pressure? Is it A. 80/50ths of a millimeter of mercury, B. 120/80ths of a millimeter of mercury, C. 140/90ths of a millimeter of mercury, D. 160/100ths of a millimeter of mercury? The answer is B. 120/80ths of a millimeter of mercury. A blood pressure reading of 120/80ths of a millimeter of mercury is considered normal. Hypertension is diagnosed when blood pressure consistently exceeds 130/80ths of a millimeter of mercury. Feeling a bit pumped about this quiz? Don't worry, the questions are designed to be informative and engaging, not pressure cookers. Let's keep those hearts healthy and happy. Question 2. Which of the following lifestyle factors is not a risk factor for hypertension? A. Smoking. B. Sedentary lifestyle. C. Healthy diet. D. Excessive alcohol consumption. The correct answer is C. Healthy diet. While a healthy diet can help prevent hypertension, smoking, a sedentary lifestyle, and excessive alcohol consumption are known risk factors. Question 3. What is the primary cause of secondary hypertension? Is it A. Genetics, B. Unknown, C. Underlying medical condition, D. Aging? The answer is C. Underlying medical condition. Secondary hypertension is caused by an underlying medical condition, such as kidney disease or hormonal disorders. Question 4. Which of the following medications is commonly used to treat hypertension? A. Antidepressants, B. Antibiotics, C. Antihypertensive drugs, or D. Antifungal medication? The answer is C. Antihypertensive drugs. Antihypertensive drugs, such as ACE inhibitors, beta blockers, and diuretics, are commonly prescribed to lower blood pressure in individuals with hypertension. That question hit the spot, didn't it? Remember, high blood pressure often has no symptoms, so regular checkups are crucial. Question 5. What is the term for high blood pressure that is consistently elevated at rest but normalizes during sleep? Is it A. Nocturnal hypertension, B. White coat hypertension, C. Masked hypertension, D. Resistant hypertension? The correct answer is A. Nocturnal hypertension. Nocturnal hypertension refers to high blood pressure readings during sleep, which may increase the risk of cardiovascular events. Question 6. Which of the following complications is not associated with untreated hypertension? Is it A. Stroke, B. Osteoporosis, C. Heart attack, or D. Kidney disease? The correct answer is B. Osteoporosis. While hypertension can lead to various complications such as stroke, heart attack, and kidney disease, it is not directly associated with osteoporosis. Feeling a little salty about that question? Remember, a healthy diet is key to keeping your blood pressure in check. So, ditch the processed foods and embrace those fruits and veggies. Question 7. What is the term for high blood pressure that occurs only in a medical setting but not in everyday life? Is it A. Nocturnal hypertension, B. White coat hypertension, C. Masked hypertension, or D. Resistant hypertension? The answer is B. White coat hypertension. White coat hypertension is characterized by elevated blood pressure readings in a clinical setting but normal readings outside of it. Question 8. Which of the following dietary components is recommended to reduce hypertension? A. High sodium intake, B. Low potassium intake, C. High fiber intake, D. High saturated fat intake? The correct is answer C, high fiber intake. Consuming a diet rich in fruits, vegetables, and whole grains, which are high in fiber, can help lower blood pressure. Question 9. What is the term for a hypertensive emergency characterized by severely elevated blood pressure and acute organ damage? Is it A, chronic hypertension, B, malignant hypertension, C, secondary hypertension, D, prehypertension? The answer is B, malignant hypertension. Malignant hypertension is a severe form of hypertension characterized by extremely high blood pressure levels and acute organ damage, requiring immediate medical attention. Question 10. Which of the following is not a modifiable risk factor for hypertension? Is it A, obesity, B, smoking, C, family history, D, physical inactivity? The correct answer is C, family history. While family history can increase the risk of hypertension, it is not a modifiable risk factor like obesity, smoking, and physical inactivity. Alright, explainers, halfway through the hypertension challenge. Those answers are looking sharp. But before we dive into the second half, let's take a quick explainer brain boost. Did you know that exercise is a fantastic way to manage high blood pressure? Getting those steps in helps your heart pump more efficiently, keeping your pressure in check. So why not do some jumping jacks or stretches while you ponder the next question? Feeling refreshed and ready to learn more? Excellent. Back to the quiz. Question 11. What is the term for the pressure in the arteries when the heart is at rest between beats? Is it A, systolic blood pressure, B, diastolic blood pressure, C, pulse pressure, D, mean arterial pressure? The correct answer is B, diastolic blood pressure. Diastolic blood pressure represents the pressure in the arteries when the heart is at rest between beats, reflecting the minimum pressure in the arteries. Question 12. Which of the following is a lifestyle modification recommended for managing hypertension? A, decreasing physical activity, B, increasing sodium intake, C, limiting alcohol consumption, or D, smoking cessation? Answer: D. Smoking cessation. Quitting smoking is a crucial lifestyle modification for managing hypertension, as smoking can raise blood pressure and increase the risk of cardiovascular disease. Question 13. What is the term for blood pressure that remains high despite the use of multiple antihypertensive medications? Is it A. resistant hypertension, B. malignant hypertension, C. secondary hypertension, D. white coat hypertension? The correct answer is A. resistant hypertension. Resistant hypertension refers to high blood pressure that remains elevated despite the use of 3 or more antihypertensive medications. Don't worry if you don't know every answer. The important thing is you're learning. High blood pressure is a common condition, but there are ways to manage it effectively. Question 14. Which of the following is not a potential complication of hypertension? Is it A. atherosclerosis, B. hypoglycemia, C. heart failure, D. peripheral artery disease? The answer is B. hypoglycemia. While hypertension can lead to complications such as atherosclerosis, heart failure, and peripheral artery disease, hypoglycemia is not directly associated with hypertension. Question 15. What is the term for a blood pressure reading that is elevated but does not meet the criteria for hypertension? Is it A. prehypertension, B. hyperglycemia, C. hypercholesterolemia, D. hypertensive crisis? The answer is A. prehypertension. Prehypertension refers to blood pressure readings that are higher than normal but do not meet the criteria for hypertension, serving as a warning sign for potential future hypertension. Question 16. Which of the following is a common side effect of certain antihypertensive medications? A. weight gain, B. increased blood pressure, C. increased heart rate, or D. increased appetite? The answer is A. Weight gain. Weight gain is a common side effect of certain antihypertensive medications, particularly beta blockers and some calcium channel blockers. Question 17. What is the term for high blood pressure that is primarily due to an underlying medical condition? Is it A. Primary hypertension, B. Secondary hypertension, C. Isolated hypertension, D. Essential hypertension? The correct answer is B. Secondary hypertension. Secondary hypertension is high blood pressure that is caused by an underlying medical condition, such as kidney disease or hormonal disorders. Question 18. Which of the following relaxation techniques may help lower blood pressure? A. Vigorous exercise, B. Deep breathing exercises, C. High-intensity interval training, D. Caffeine consumption. The answer is B. Deep breathing exercises. Deep breathing exercises, such as diaphragmatic breathing or guided imagery, can help reduce stress and lower blood pressure. Question 19. What is the recommended dietary approach for managing hypertension? Is it A. High sodium diet, B. Low potassium diet, C. DASH diet, dietary approaches to stop hypertension, D. High cholesterol diet? The correct answer is C. DASH diet, dietary approaches to stop hypertension. The DASH diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products, has been shown to effectively lower blood pressure. Question 20. Which of the following is a potential complication of hypertensive crisis? Is it A. Bradycardia, B. Hypotension, C. Stroke, D. Hyperventilation? The answer is C. Stroke. Hypertensive crisis, characterized by severely elevated blood pressure levels, can lead to complications such as stroke, heart attack, or organ damage if left untreated. There you have it, explainers. You've tamed the hypertension challenge. Remember, knowledge empowers you to take charge of your health. So keep that blood pressure in check, and keep those minds sharp. Don't forget to like and subscribe for more informative and engaging quizzes from the Explainer fam.